Well, good afternoon, everyone, and welcome to today's webinar hosted by Simon's VIP Connect titled Introduction to 16p11.2, What We Know and What Questions Remain. We are very excited to have so many parents registered for our first webinar, and we hope that you will find this and future webinars to be an excellent source of information for you and your family. My name is Andrea Paul, and I am one of the Simon's VIP genetic counselors. And today I will be joined by Audrey Bibb, who is also a genetic counselor here at Simon's. Audrey, do you want to say hi?
Hi, this is Audrey.
And of course our speaker, Dr. Wendy Chung, who is the principal investigator of the Simon's VIP study. Our plan for today includes a 30 to 40 minute presentation during which Wendy will provide an overview of the features that have been reported in people with 16p11.2 deletions and duplications, a discussion of the Simon's VIP study design and the medical, behavioral, and learning assessments that we are using, reasons why we are interested in 16p research and what we hope to learn from the Simon's study, as well as plans for future research and how your family might be involved in that. Following this presentation, there will also be a 15 to 20 minute question and answer period. And I know some of you have already submitted your questions for Dr. Chung by email, and I definitely appreciate that. And I also want to encourage each of you to participate by submitting questions during the presentation. To submit your questions, you'll just use the chat window on the lower left-hand side of the screen, and Audrey and I will be monitoring the questions that come in, and we'll be sure to get to as many as we can today. Please keep in mind that we will not be able to answer very specific questions regarding your child or make recommendations for your child's medical management, but we do welcome all general questions about 16p11.2 deletions and duplications. This webinar is being recorded, and the recording will be posted on our website as well as our Facebook page so that you can share this information with other family or friends. And now, it's my pleasure to introduce our speaker, Dr. Wendy Chung. Wendy received her MD from Cornell University Medical College and her PhD from the Rockefeller University in genetics, and she is currently an assistant professor of pediatrics and medicine at Columbia University, where she directs the clinical genetics program and also performs human genetic research. Wendy is also the principal investigator for the Simon's VIP study and is particularly interested in understanding the features associated with 16p11.2 deletions and duplications, including how and why it impacts people differently. So Wendy, welcome. We are very happy to have you with us today and looking forward to hear what you have to share with us.
Thanks very much, Andrea. I'm very glad to be here today, and I hope we'll be able to eventually actually meet some of you face-to-face. But in the interim, I hope this will give you an introduction to at least what we know right now, and I hope some of the gaps in knowledge that we're trying to hopefully fill with some of the research that we'll be telling you about. So I'm hoping that everyone can hear me. If there's any audio problems with my feed, just send in a little chat message and we'll try to get that adjusted, but hopefully everyone can hear. As we go through, I hope I'll technically be able to manage all of this. I apologize if I fumbled just like I did, but this is my first Ready Talk, so this is a new experience for me. What I'm showing right here is a picture of a chromosome. In this particular case, chromosome 16. And this is the small region. Let me just see if I can get my pointer to work here. Right over here, this is the small region that we're talking about on chromosome 16. And as Andrea was saying, some of you within your families have individuals who are missing this tiny little piece of chromosome 16, and in other cases, there are people in your family who may actually have an extra copy of this small piece of chromosome 16. And that's what we're going to be focusing on today. In some of your families, this is something that's been inherited and passed down generation to generation, but in others in your families, this is something that actually started new, potentially with your child. And we see both of those things. We'll be actually going through some of those differences in some of the slides we'll be talking about today. I just want to spend 1 second on the genetics. For those of you that either the duplication or the deletion is inherited, it's inherited in a way that we call autosomal dominance. And what that means simply is that either boys or girls, males or females, can be affected. And if you have this either deletion or duplication, you have 2 copies of chromosome 16. You'll have 1 copy that's completely normal, and then the squiggle is to designate the 1 copy of chromosome 16 that either has the deletion or the duplication. And for those individuals that carry the deletion or duplication, deletion, when they go on to have children, there's a 50-50 chance, like flipping a coin, whether they'll pass down the normal chromosome 16 or the one with the deletion or duplication. And so their children, in approximately 50-50 ratio, will either have or not have the deletion or duplication. And as we'll be talking about, just because you have the deletion or duplication doesn't mean that necessarily everyone, even within the same family, will have the same problems, the same manifestations of that. There certainly is a lot of variability, and as we'll be talking about through some of these slides, I'm going to be talking about the full spectrum of all of the different possible manifestations, but any one person certainly does not have all of the manifestations. They'll only have a small subset of the things that I'm going to be talking about. So as researchers, what led us to this particular region of the chromosome, of chromosome 16 particularly, in this particular region that we call p11.2? Well, researchers, I'm going to give a little bit of history, and it's really not that old even. This is really a very new finding. But approximately 2 years ago, people started reporting as they were looking for genetic causes of autism. They started looking around all the chromosomes to find out whether or not there might be chromosomes that either had this characteristic of a small piece that were missing or a small piece that were extra that might be causing for the autism within those individuals. And so this line here that I'm showing in the table was actually what started all of this research. And there were several different investigators who were looking, again, for the causes of autism, and they found that in approximately 1%, a little less than 1% of their study participants, they actually had deletions within this region on chromosome 16. And when they also looked more carefully, they also saw that about 0.5% of the individuals within their autism study had duplications of this region of chromosome 16. So some people had deletions, some people had duplications. And that was the beginning of all of this. Other researchers studying other different types of neurological conditions started looking at their study populations as well to see whether or not there might be problems not only with chromosome 16 but other chromosomes as well. And so people looked at, for instance, disorders like schizophrenia or also what we call bipolar disorder or a combination of depression or mania. And in fact, they saw that in some cases there was an increased prevalence of this. Now, one thing I want to point out here is that this top line here of controls, and this is across all different studies. You can see it's a huge number of people who have been looked at, almost 30,000 individuals. What you'll see is that there are, not a large number, but some normal individual controls that actually have either the deletion or the duplication. So it is possible to be within that normal control population and have one of these variations. But on the other hand, by comparison, when you look at individuals with schizophrenia in these studies, they have, again, about the same prevalence of the deletion as the normal control population, but there's a higher prevalence of individuals with schizophrenia with the duplication. Similarly, if you look at individuals with bipolar disorder, very slightly increased prevalence within individuals with the deletion, but again, higher prevalence of individuals with the duplication. So we'll get into this a little bit more, but I think this is showing us that there can be different manifestations for the deletion and the duplication. They certainly are different. They have distinct features that are unique to each of them. And that in particular, it looks like autism may be associated, or at least initially was thought to be associated with the deletion. I don't know that this is always the case, and we'll talk a little bit more about that, but that the spectrum is certainly much more diverse with duplications. There are a greater number of types of manifestations that individuals can have with the duplication. So the next studies that were done were to look at individuals who had had clinical genetic testing. So in other words, they had gone to their doctor for one reason or another, and their doctor had ordered a test that looked at their chromosomes in very close detail, in high enough detail that they could actually see this very small piece of chromosome 16 that was either deleted or duplicated. And so there were laboratories that reported what their findings were for individuals with the 16p11 deletion or duplication, and this is one of those studies. And so when you look at how the doctor or the nurse filled out the requisition, in other words, the indication for why that patient had that test sent out, and when you looked at the subset of individuals that came back positive for either the deletion in blue or the duplication in red, you'll see the variety of different types of indications that they had their testing sent off for. And the highest bars here, which you can see on the left, are individuals that either had problems with developmental delay or mental retardation. And in fact, if you look at over half of the individuals with deletions had some sort of developmental disabilities, and approximately 3/4 of those individuals with the duplication, again, had some sort of developmental delays. There were, on the other hand, other manifestations, other reasons why patients had this testing done. In some cases, we talked about earlier autism, so some of those individuals that were referred for clinical testing had autism. But one of the things to realize is that this is certainly a relatively small proportion, I would argue, of the individuals with the deletion or duplication, approximately a fifth, a little less than a fifth, with officially referred for autism. In some cases, there were seizures. In some cases, there were other behavioral problems like attention deficit disorder, particularly in individuals with the duplication. And in some cases, birth defects, and here abbreviated for multiple congenital anomalies, but in other words, birth defects, and in some cases, problems with growth. So again, a different way of looking at this, people that now were coming to the doctor with problems or issues that they were concerned about. Some of those individuals, again, coming with problems, either neurological problems or birth defects or problems with growth. This is now sort of further looking into that study and looking at as many patients sort of in greater detail as possible. And it's one of the things I want you to realize is this is a relatively small study, and in fact one of the reasons why we need to actually get better data. But this is based on 16 patients with the 16p deletion or 10 patients with the duplication, and now studying them in a little bit more detail to understand what was going on with those individuals. Again, in blue are the individuals with the deletion, and in red the individuals with the duplication. You'll see that what's especially notable, I think, is specifically within the area of how the brain was working, these individuals seem to have more problems with speech delay, particularly. Speech seemed to be an especially difficult thing for these individuals. On the other hand, for instance, what we often call gross motor delay, or problems, for instance, learning to walk and run and ball and things like that, that seemed to be less of a problem. I'm not saying it wasn't a problem. Certainly half of the people still had those issues, but much more common to have problems with speech, for instance. Again, a subset of those individuals also had problems with behavioral problems, problems focusing, attention deficit disorder, as well as a subset of those individuals also with autistic spectrum disorder. So in trying to look at this, and this is just in a table form, really about the same information, but looking at this in a little bit more detail, I also want to point out a couple other things. When we looked at the individuals within this particular study, again, relatively small study, again, if you look at how many of these were what we call de novo or inherited, when you look at the deletions, the vast majority of them, 80% of them, or 8 out of 10, were de novo, or in other words, not inherited from either one of the parents, but started first with that child. On the other hand, and in contrast, when you look at the duplications, it's interesting that, again, the numbers are small, but it's almost evenly split. In about half the cases, they were inherited from a parent, and in another half of the cases, they actually were started with the child were something new. And so this is starting to give us some additional insight. I think this is something that we're seeing across other studies, across other laboratories is too, is that there are some differences between the deletions and duplications and how they come about. As I just wanted to sort of make this very personal for you. These are some of the pictures of the lovely children and adults in this particular frame with the deletion. One of the things I think you'll see is that they're awfully cute, is one thing I have to say. And the other thing is that you'll see that they're from all different parts of the world. There's no specific single ethnic backgrounds. There can be individuals we've seen that are European ancestry, Asian ancestry, African American, Hispanic. This is really not something that's specific to any one different ethnic group. We see individuals of all different ages, as you'll see here, from the little itty-bitty guys to even adults that we're finding who have the deletion or duplication. Again, this frame is with the deletion. And then in the next slide here, you'll see individuals with the duplication as well. If you think about the person that you know, either with a deletion or duplication, you may see some similar facial features within, or recognize some similarities within individuals that you know, as well as with some of the people in the pictures here. Although I have to say that I don't think that any two people are absolutely distinct or absolutely the same. Obviously, this young man here, for instance, looks quite different than this young man here. And so again, there's variability even with individuals with the same duplication. So none of us are exactly alike. Beyond that, from a medical point of view, there were certain types of either birth defects or medical problems that were seen. And I'm going to first talk on this slide about the deletion and the next slide about the duplication. And this is one of the important things as we medically try and take care of these individuals, to be able to be aware of some of the things that may be there or that maybe we need to look for. Again, let me emphasize that any one patient doesn't have all of these manifestations, and in fact, in terms of the birth defects, there are certainly many patients who have none of these manifestations, who have no birth defects or no evidence of any of these features at birth. There certainly have been some serious ones, though, serious ones including congenital diaphragmatic hernia, other birth defects. These are things that can be repaired, by the way. Most of these things are amenable to surgical repair, things like cleft palate or a hole on the roof of the mouth, polydactyly or having an extra finger or an extra toe, again, things that can be easily surgically repaired if desired, a hole in the heart or congenital heart disease, pyloric stenosis, which is basically a sort of stricture or a smaller opening that comes at the end of the stomach or around the stomach, again, something that can be treated surgically. Problems with the kidneys, where either they may be formed abnormally and they have extra bubbles or extra cysts in them. For males, problems with the way the penis forms and having some extra tissue that may act as sort of an extra string tied, or rib fusion, in other words, having ribs that are stuck together. For, oops, sorry, I skipped a slide. For individuals, I'll get this right in a second. For individuals with the duplication, some similar types of birth defects, slightly different spectrum. Again, individuals that had either a hole at the roof of their mouth, cleft palate, or a place where the lip did not come together or fuse normally, and so there's a cleft or an opening in the lip. Problems with the way the spinal cord formed, again, that can be surgically fixed. We talked about diaphragmatic hernias, also problems with the way the intestines rotated around. And instead of having one kidney, or rather two kidneys, having one what we call horseshoe kidney or one sort of U-shaped kidney, as well as some problems in terms of the way the penis forms. So again, some birth defects, some relatively minor, some more serious, but things that can be seen in certain individuals. One of the other things we've noticed is that if we look at individuals with either the duplication or deletion, there can be differences in their growth pattern. And so one of the differences that's been quite noticeably different between the two groups is that individuals with the deletion tend to have a relatively large head size, whereas individuals with the duplication tend to have relatively smaller head size. And that's something that we'll be interested in understanding better, how that relates to the way the brain is functioning in addition to the way just structurally or anatomically the brain is. In addition, we've been looking at growth patterns for individuals, not just in terms of their head, but also their height and their weight and how that changes, especially over time. And this is a kind of a complicated graph, but these are individuals by age, so they're going over time from birth and as they get into adult periods. And then this is something called the body mass index, or a measure of exactly whether or not someone's overweight. And these are shown to be the normal curves here, so this sort of squiggly line here. If you're under this part of the curve, then that's considered normal growth, and so those would be individuals down here with normal growth patterns. Whereas once you get above this curve, sort of this area in between here, it's individuals who are on the heavier side. And then finally, when you get up here, individuals who are really getting to be in a situation where medically their weight could cause them problems. What's interesting is if you look at excuse me, at individuals with the 16p deletion, when they're young, they actually seem to do pretty well in terms of their growth. They're a normal body weight. They're doing well in terms of their metabolic status. But as they're getting older, interestingly enough, things start changing. And a lot of individuals start putting on weight. And in fact, as they get into adulthood, 30 years and older, they end up having significant problems with their weight. And so that is one area that I hope that by looking at those that are a generation older, we can learn some important information that we can use for the younger generation about how we can be effective in terms of things like diet, exercise, healthy living choices that we can help people with and that we can control and have an influence to keep them healthy for the long term. So Ellen Hansen, who's actually the one of our investigators up at Harvard who's leading our psychological testing, has also looked very closely at individuals with the 16p11 deletion. And as she did this, one of the things that I want you to appreciate is that there's quite a range, quite a spectrum in terms of how individuals function. And she actually did a very detailed study looking at some different cognitive testing, looking specifically at verbal ability as well as nonverbal ability. And just to orient you for these, a score of 100 is considered average, and things that are above 100, of course, above average, and less than 100 below average. And these are just individual subjects. Each line is an individual participant in her study. And you can see that there are certain individuals who had really some significant problems. They had relatively low scores, less than 49 on these scales, and they had features of autism. So there can be associated with this some individuals with some significant intellectual disabilities. On the other hand, one of the things that I think is really impressive is that if you look at this individual over here, for instance, again, very, very good scores. 100 on the verbal score, and the nonverbal reasoning actually extremely high. This is considered, the top 2% within the population. So even though this individual had the 16p deletion, still done very, very well in terms of their functional status and their performance on these tests, even though this particular person did have features of autism associated with that. So the thing I want you to appreciate within all of this is that there certainly are very big differences, or can be very big differences from one individual to another. And one of the things that I think will become apparent as we start going through our study more carefully is that there do seem to be some differences between verbal and nonverbal reasoning. So if you just look quickly through the columns here and compare the scores on the left to the right, not in every single case, but in most cases, individuals scored lower on the verbal than on the nonverbal reasoning. And I think that's an area that as we try and figure out how we can help people, one of the areas where I think we're probably going to need to support people a little bit more is in the area of the verbal skills, learning to read and write and process what they're hearing, and language I think is going to be an important way that we can help individuals. So just as a brief summary of all this information, I think we're beginning to understand better that although this started really as a study of autism, there may be individuals who have some behavioral differences, but they may not necessarily be strict autism. They may be some features that are within the spectrum. They may certainly have some intellectual challenges, specifically in the areas of language delay, but I think we're only beginning to realize that this may be more complicated than just simple autism. It may actually be much richer and help us to understand things better. This is a complicated picture, but is what we often do as geneticists in terms of drawing out a schematic picture of a family. And in this particular family, I just want to draw your attention. These are 3 males. We make these squares to designate males, a father and 2 sons that all had the 16p deletion. And the thing I want you to, again, realize is that this is a case where this ran in a family, but there are actually quite dramatic differences between the different individuals. The father in this particular case had features of autism or ASD, had some learning disabilities, had some language delay, and he had 2 sons or has 2 sons. In fact, one son very much like him in terms of his intellectual challenges, but another son in which he really had just relatively mild language delay, didn't have any of the autistic features, didn't seem to have the severe learning disabilities, and certainly doing much better, at least academically. So again, within a family and within individuals across families, oftentimes we see quite a bit of difference in terms of that. And one of the things we'd like to understand better is, again, what accounts for those differences. I mentioned this very briefly before, but one of the other things is that when we think about deletions, again, the majority of them, this is now across all studies that have been published, the majority of the deletions, in fact, are ones that start new with that child, whereas when we look at the duplications, it's really the minority of those that start new with the child. And so that's one of the differences that I think we'll be able to appreciate, that there may be, especially within individuals who are carry duplications, probably even a wider spectrum in terms of manifestations of this. So let me switch gears for a second and say that for the Simons Foundation, this is called the Simons VIP because it's actually funded by and sponsored by the Simons Foundation. And the Simons Foundation, amongst its goals, one of its major goals is to better understand autism spectrum disorder and especially what the underlying genetic basis for that is. And really due to remarkable work that they've been able to achieve, it's become obvious that certainly autism is not a single disorder, and from a genetic point of view, it's in fact many, many, many different disorders. And one of the important opportunities I think we have is now to try and understand what are the similarities and what are the differences between those different genetic disorders which may have features of autism. So we started thinking about knowing that there were several different genetic, at least underpinnings for autism, and trying to understand better what those similarities and differences might be. And again, looking at what the most common genetic causes of autism were, it became obvious that the 16p11 deletion was actually one of the most common genetic causes of autism. And so we started thinking that, well, wouldn't it be wonderful to understand that much more deeply, to understand that much better, with the goal, as I'll get into, but obviously to try and make this better. And so we decided almost a year ago actually, that what we'd like to do is study approximately 100 people that had the deletion, 100 people with the duplication, and really try to understand much better what was going on. And as we were started to do that, we wanted to do this at several different levels. We wanted to understand from a medical point of view the health and the challenges from a medical point of view, but also when it came to neurological functioning, behavior, and how the mind works, to be able to understand that much better as well. This can be done obviously within the context of understanding individuals with deletions and duplications and being able to compare them in some cases to other members of their family who serve as controls for us, and to understand that there's actually quite a bit of diversity within even the group with deletions or the group with duplications. That is, that not everyone's the same. Within all of this, we wanted to understand what we could see in terms of how the brain looks, but more importantly, how the brain functions. And that as we could do this, to understand how this changes over the life course, and potentially with the opportunity to be able to have an impact and to change and improve things for the better, especially as children are young, and helping them give the longest potential to their future, the greatest potential to the future. So in doing this, I think ultimately what we'd love to be able to do is to understand from you what's worked for your children, for your family members, to try and gain collectively from that experience, so that hopefully we can try and figure out a way where we might be able to develop interventions that would actually make things better as children are growing up, and of course for the next generation. And so to do this, we've actually invested quite a bit of effort and energy to be able to make what we hope is going to be really a stellar team of investigators that are going to help us come up with these answers. And so this is actually, I think, an impressive group of people, both in terms of number as well as expertise. We've got really a very dedicated team of individuals from the Simons Foundation who are helping with this. Many of you know Audrey and Andrea from Emory, who are helping us in terms of connecting with families and being able to help them understand what's going on within their families and their kids, and also to, if they're interested, to participate within the Simons VIP program, to be able to understand in several different aspects what's going on with individuals with deletions or duplications. duplications. We've got a team here that's led again by Ellen Hansen of psychologists who are able to really help us tease apart the different ways in which the brain is functioning and understand what the strengths and the weaknesses are. We've got a fantastic group of neurologists and neuroradiologists, led in large part by Elliot Shearer, who are going to help us with how the brain looks by looking at it structurally in the MRI, as well as functionally actually understand how the brain functions, how it's connected, how the different pieces may be acting slower or faster or in different ways for individuals with deletions and duplications. And then finally, lots of people who help us in terms of understanding the data better, both at a biological level as well as from a statistical point of view in analyzing the data. So I just want to take a couple minutes to briefly explain what this study is about in terms and give you also some nitty-gritty detail, which some of you might wanted to know about whether or not this is something that you think might be something you or your family would be interested in. As I said, one of the things we do is from a medical point of view, try and understand what's happened to individuals. This is something that Audrey and Andrea actually take the lead on, and for some of you who have participated already know what this is like. But we go over the individual to understand what's happened to them from a medical point of view, if they've had any sort of birth defects or any medical diagnoses. Relatively painless process. That's something that we do in terms of gathering information from you. Find out about your family history, who's in the family and how they're related, and then trying to understand who within the family has the deletion or duplication so that we know in what ways we need to study those individuals. Part of this also, once you actually get enrolled and are in the study, includes taking pictures so that we can understand whether or not there might be any specific facial features that might give us some tip-offs into differences as well. This is a long list, but for those individuals who enroll in the study, they're sent to one of 3 different clinical sites, Harvard, University of Washington in Seattle, or Baylor Medical College, and they go through a very detailed and comprehensive list of psychological evaluation, everything from measures of autism to measures of intelligence to individual behaviors that might be specific or quite characteristic of children with either deletions or duplications, and also things to try and understand learning and learning styles, and all sorts of questions that I'm not even sure from my experience how big these are, but we're interested in knowing. So everything, for instance, from whether or not sleep is an issue to if there are particular eating issues that seem to be a difference. But we're trying to really do a comprehensive survey to understand if there are big issues that we may not have been tuned into, but that are issues and challenges, and importantly, things that we can do to make life better for individuals with deletions or duplications. The testing at the sites goes through a 2-day period. Again, part of this is the psychological testing, and part of this is what we consider the neurological testing. It's actually having an exam with a neurologist, testing reflexes, testing strength. For those individuals that are of the appropriate age to do so and can do it, actually getting a brain MRI, and then phase 2 of this is going to be at a separate study site and separate study visit, actually getting what we call a functional image of the brain. That is actually being able to take pictures of the brain while you're doing a specific task and see how the brain functions and if the connections are seeming to function in the right way, in the right sequence, but to understand that a little bit better. As many of you, I think all of you probably have seen the website for the Simons VIP Connect. We hope that this has been helpful to you before, and we hope that this will continue to be a sort of place that the community can gain resources. Again, as Audrey and Andrea have done, they've posted information, scientific information, as it becomes published. We'll keep this up to date. The webinars that we're going to be having, we'll try and feed you and keep life organized a little bit in terms of information and resources that may be helpful, as well as to the extent that you want to use it as a portal for communication. I just wanted to give you a little update in terms of other people that have enrolled in the study. We've had people really from around the country and literally around the world. I just showed the United States for right now, but that has signed up with the VIP Connect and signed up for the study. Got people all over the country that are already signed up or get in the process of getting ready to participate. In terms of the ages, we've got everyone from the little bitty infants all the way up through adults. and individuals that even go beyond the age of 18 here. And we're especially excited about the fact that we've got a broad distribution, because I think that'll help us understand how things develop, and I hope what we'll be able to do is actually follow individuals over time too, to see how things do develop in individuals. In addition, people have gotten to know us through a variety of different mechanisms, and we'd be glad if you have any feedback in terms of what's been helpful or not. But everything, as many of you know, from Facebook to our website to doctors that have put you in touch with us, and we're glad to do what we can, like I said, to be able to spread the word. And the number of individuals who have been connecting with us just keeps increasing at a pretty linear pace over time. So we hope we're going to be able to really build a very rich community that's going to be helpful for everyone. Beyond this, the Simons Foundation in particular is really, really committed to understanding 16p very deeply. And in addition to the studies with Simons VIP, understanding that we really need to be able to get a very deep understanding of this, they've committed really extensive resources to building literally a mouse model for this to understand that better, even a zebrafish, if you can imagine, but a little tiny translucent fish that we can use to understand which genes within here might be the more important genes, and really being able to hopefully one day understand what other genetic variation besides 16p might be contributing, other genes, for instance, in individuals or other regions. So I'm going to stop there, but I think Andrea and Audrey have probably been collecting questions, and I'll just open it up to the group.
Okay, great. Thank you. Our first question is actually from two parents, Melissa and Christy, and they are wondering if you believe that this disorder is or can be neurologically degenerative or involve regression.
Right. So one of the good things I think in terms of this is that to be just answered very succinctly, I think the answer is no. So, excuse me. There are conditions that we know about, genetic conditions, specifically that do have neurological regression, where kids or individuals deteriorate over time and they take major steps back and they don't regain those abilities. And I absolutely do not think that 16p is one of those types of conditions. I do think there are periods of time, and this is true, for all of us as parents, where we see our kids, all of our kids, normal kids as well as our kids with deletions, duplications, that may have a period where they seem to get something for a little bit of time and then they forget how to do it and then it comes back to them again. And I think you may see that as well with kids with deletions or duplications, but I don't think it's a permanent sort of thing. So that I think if I could plot out the trajectory for you, I think the good news is that the trajectory just continues to go up and up and up and continue to gain skills, continue to go forward over time. The slope of that line may be a little bit different from other kids. That is, it may take a little bit longer for things to gel and things to really get mastered, but once they get mastered, truly mastered, they're there. Okay.
Great. And so I know that these parents specifically asked that question because they do have children who have experienced regressions. And it sounds like from your answer you're kind of thinking that it's not due to this duplication or deletion. Possibly something else is going on in that child or the family that can be responsible for that.
That's right.
Okay, great. This next question is also from Christy. She asks, is there a risk for mitochondrial disease?
So this deletion itself does not increase the risk for mitochondrial disorders. For those of you that haven't thought about mitochondrial disorders, I'll just say that the mitochondria are these little tiny, basically powerhouses within our cells that give our cells energy. And so mitochondrial disorders can have a wide variety of manifestations, some very severe, some relatively mild. This particular set of genes in this region for chromosome 16 is not sort of a mitochondrial-rich set of genes. In other words, I don't think it confers increased risk for mitochondrial disorders or mitochondrial dysfunction. So I don't think that there's any additional risk just because of this particular deletion or duplication for having mitochondrial problems. One of the things that I have to say that constantly amazes me, though, is how complicated we are as humans. And so certainly I think for most people with either deletions or duplications, this is their major sort of issue in life. But I think there are, in rare circumstances, individuals who have not just the 16p deletion or duplication, but may have actually something else that's contributing, some other genetic factor or non-genetic factor as well. And so it's not impossible to have two diagnoses, but certainly it's the exception rather than the rule.
Okay, great. Nicole is wondering if anyone has studied pain tolerance in these children.
So in fact, this is not, if you look through all the different publications that have come out, this is not something that's been studied or reported at all. I would not be surprised if there is a difference in terms of sensory issues just in general, so issues about being particularly sensitive either to certain textures or certain things, for instance, even in the mouth and chewing and that sensation, as well as pain, either having a high tolerance for pain, high threshold for pain. And these things are things that may even change over time, but I would not be at all surprised if that's the case. And certainly, I'll just say this in general, that if there are things that you notice about your kids or your loved ones that you think are particularly characteristic about them, I trust your impressions. So by all means, let us know. You know your kids, you know your family members much better than we ever will, and we need to understand from you what are the issues, because you're the ones who actually know this much better than we do, and we want to learn from you.
Okay, great. Christy is wondering if this disorder lends itself to causing multiple types of seizures in a child. Right.
So it clearly is the case that although it's not the majority, a certain important minority with deletions and duplications are susceptible to seizures. And seizures are a complex sort of thing. As many of you know, there are multiple different seizure subtypes, and individuals may not have a pure form of seizure in the fact that they may not have just absence seizures or just myoclonic seizures or just tonic-clonic seizures. They may actually have either different seizure subtypes or with different therapies, they may sort of evolve from one seizure subtype to another. This is not something that's been very well described at this point, in large part because the numbers have not been large. I do think we have the opportunity. I think one of the things we're trying to do is potentially the largest series of individuals with deletions and duplications. Again, our goal is about 100 of each, and I hope that we'll start to have enough numbers to be able to make sense of this. And certainly, for those of you who are going to participate in the Simon's VIP study, we're going to try and work with you to try and understand both from, for instance, EEGs that have been done in the past or from what your neurologists have thought the different seizure subtypes were like, trying to understand that in combination with some of the neurological and imaging and psychometric testing that we're doing, trying to understand how the brain's working in toto.
Okay, and sort of a follow-up question to that, Hillary is asking, when would seizure activity present? Is it across the lifespan or particularly young children or older adults?
Right. So it's more commonly the case in younger children, although I don't think we know well enough the natural history of this to be able to say if you make it to a certain age, for instance, are you off the hook? But in general, it's something that I think we're more likely to see, for instance, before children start going to school than all of a sudden popping up one day, when you're 25 out of the blue, never having had a seizure before. In general, with seizures, there are certain things that can bring them out. So, for instance, fever is one of the things in kids that's especially common to bring seizures out. So, part of this is it may be not just the genetic susceptibility, but some other, if you will, environmental exposure or something else that is the right setting for that seizure to appear when it does.
Okay. And Melissa is wondering, what would cause a child's muscle tone to change, to go, for instance, from being hypotonic to hypertonic, from loose to tight, and cause muscle change from side to side?
So we don't always know the answer in any one person for this, but there are individuals, certainly I see quite frequently, that even have in the same individual at the same time parts of their body that are hypotonic or loose, as well as in the same person other parts of their body that are hypertonic or tight. And so very oftentimes, for instance, I'll see that someone in their trunk, the muscles that they're using, for instance, to sit up, they may be loose there, but they may be tight, for instance, in their ankles or in their legs. All of this basically is mediated by the brain. So in other words, the brain is sending signals to the muscles and telling it to, through the nerves, telling it to either be tight or be loose. And the simplistic answer to this is there's a problem with the way the signal's getting there. The brain's not working completely correctly to set that tone at the normal stage. It's getting its wires crossed, and it's not exactly sending the right signal to all the parts of the body correctly. In general, I would say that when children are younger, it's more common to see the hypotonia or the loose muscle tone. And then in some children, it can evolve, if they don't get good therapy, to hypertonia. But I think in many cases, we're able to actually help tremendously with physical therapy to correct many of these tone problems and many of the problems, especially when it comes to tendon tightening or the need for surgery later on. So I do think that there are opportunities to intervene in very important and positive ways, but essentially what this comes down to is differences in the way the brain functions. And again, I think that's part of what we hope we'll try and be able to piece together and figure out from some of our neuroimaging studies particularly.
Okay, great. And another question from Denise. Are you finding that children with the deletion have a lot of GI issues, such as GERD, gastric ulcers, or Crohn's?
So I don't know that we know all the answers to these yet. I will say that for GERD in particular, or gastroesophageal reflux disease, for those of you that don't think in alphabet soup, that is something that is more common. Certainly, especially as children are younger, more common for them to have reflux and to barf up a little bit more than usual. As children get older in general, that muscle tone in their belly basically gets stronger, often as their muscle tone in their legs and their arms gets stronger too. And so lots of times that is something that gets better over time. I don't think we have enough information about some of the older individuals to really know whether or not at least Crohn's disease, for instance, is something that's very prevalent. It's something we haven't seen yet in the data that have come out. But in general, there may be other more subtle gastrointestinal problems, whether they be problems with constipation or problems with sort of certain type of food intolerance. I think that's one of the things very oftentimes, at least I hear from parents, whether or not this is a major, major problem, I don't think we know the answer to yet. But again, if that's something that you're experiencing, certainly something we want to hear about to understand better whether that's a core part of the deletion and duplication.
All right, and I think we'll just go ahead and wrap up with one more question from Hillary. I thought I would direct this to you, Wendy, since you're on the Simons team as well. She's asking about the Simons Foundation funding. Is it a government-sponsored program or is it a private foundation?
Yep. So the Simons Foundation is actually a private foundation, and in fact, the whole Simons VIP program, the project, is entirely sponsored and paid for by the various generous contribution of the Simons Foundation. I will just put a plug in for that. Having most of my research being funded by NIH or by the government, and with, I have to say, as I think we all have experienced the economic difficulties these days, NIH has been especially hard hit in terms of funding for research and for this type of research. And I don't know if the families will appreciate this, but the opportunities that we have through the generosity of the Simons Foundation have really been extraordinary. I have to be quite honest, I don't think we could do this quality, this type of very important but very expensive type of research without this type of funding. I don't think we could ever be able to get, at least from the U.S. government, the funds we would need to be able to do such detailed, such careful study with such an excellent team of investigators. So I can say I'm personally very grateful for the contribution that they've given, and I really think it's a tremendous opportunity both for us as researchers to understand things, as well as, like I said, I hope this is going to be really the first but really a premier example of how we can work together to understand better how the brain is functioning and give us some insight in terms of how we can develop some new therapies that are going to help. I certainly personally hope that this is really just the first of these genetically very well-defined neurological susceptibilities that we can define and be able to compare it actually to children with other genetically distinct disorders, but ones that might be comparable, and try and learn from each other. I mean, for all I know, after we finish the 16p project, there may be another chromosomal disorder that, we will be able to make some very nice comparisons to hopefully elucidate all of these disorders better.
Wonderful. I think that's a great note to end on then. Thank you so much for your willingness to come and speak with us today. We really appreciate that. It was a great presentation, so thank you.
Thanks. Very pleased to be here. And like I said, we're going to dig out of the snow here, but at least I can speak for myself. I look forward very much to having the chance to continue working with the group and hopefully meet some of you guys someday.
Great.